Just gonna give it another. I'm just gonna give it another 3 minutes, everyone, to let people just trickle in, and then we'll be beginning. Okay, great, Beena, I can see your PowerPoint just fine. Actually, I do see that quite a few people have joined, so I think I will just go ahead and begin, inshallah. Okay, أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم والحمد لله والصلاة والسلام على رسول الله وعلى آله وصحبه وسلم. Assalamu alaikum wa rahmatullahi wa barakatuh, everyone. Welcome and good evening. My name is Nina Raj, and I am the Projects and Grants Coordinator at Nisa Helpline, and I'll be your host for today. Thank you for joining our workshop Talk Therapy in our series, Her Wellness Journey, in collaboration with Bell Let's Talk. Through our partnership, we've been hosting these series of virtual workshops, and they're designed to improve Muslim women's access to social support, help build their self-esteem and emotional well-being. Before we begin, just a few housekeeping rules to ensure our workshop runs smoothly. Please ensure your mic is off, though I think that's automatically placed that way. But we'd like to leave the session kind of uninterrupted. If you have any questions for Beena on Zoom, please use the Q&A window. It's actually at the bottom of the Zoom screen, to ask questions to the host and panelists. So we'll either reply back to you via text in the Q&A, and then answer your question during the live at the end, inshallah. For those on Facebook, welcome. Please share your questions in the comment section and it will be answered during the live. We'll also be sharing polling questions during the presentation to keep you engaged and help us understand your needs and preferences for future workshops. So if you guys can all please, engage in that, that would be great. Now, without further ado, this evening we're joined by our honored guest, Beena Syed, to discuss therapy and what that looks like from a client's perspective. Beena is currently pursuing a master's in spiritual care and psychotherapy. She also has an honors bachelor's in science and psychology. She's been with Nisa Helpline for over 6 years, serving in different capacities and roles, including but not limited to peer support, admin type work, and project specific work. Her interest lies in bridging the gap between the field of psychology and Islamic practice. Her aim is to use Islamic tradition to highlight the importance of mental health as well as therapeutic practices available in our rich tradition. And she's also a really good friend. So please join me in giving a warm welcome to Beena. Assalamu alaikum, Beena. How are you doing this evening?
Wa alaikum assalam wa rahmatullah. Jazakallah khair. I'm doing well. How are you?
I'm good, thank you. Now, before I hand it off to Beena, we're just going to launch a poll question right now. As I mentioned earlier, if you feel uncomfortable responding, that's also okay. You're not obligated to answer them. Your replies will remain anonymous, though, for those who choose to respond. So I'll just give you 1 to 2 minutes, then we can proceed with the presentation. Okay. So I'll just give you guys like a minute or two to respond. I see responses coming in, so that's great. Thank you guys. Just another 10 seconds. Okay, 50% of you guys have done it. All right, I'll end it right here, inshallah. Okay, Beena, take it away.
Perfect. Assalamu alaikum, everybody. Jazakallah khair for joining in today. I'm going to be talking to you a little bit about talk therapy. Nina's already shared a bit of my background. I do have a psychotherapy background, and I am pursuing my licensing as well as my further education. And so that's the background that I come to the talk today with. So we'll be together for about an hour, and I want to set kind of like an agenda for our time together. I'll quickly go over, the introduction to talk therapy, what it is, then discuss some benefits and limitations. as well as some common misconceptions when it comes to talk therapy itself and, some of the professionals. And then I wanted to share some tips on finding a therapist, and then we just go over the summary, and then we will take up any of the questions and answers. I would have loved to have had this be an interactive session, but mashallah, it's a big crowd, so that will be challenging. So please do use the Q&A to engage, or the chat to engage, and then Q&A for if you have any questions. And inshallah, we'll get to it at the end of our presentation today. We do have a quick poll because I kind of want to just get an idea of what exposure people in our audience have today to therapy itself. So if we can launch that, perfect. There we go. So just take a quick moment or two to answer the question, and then we can move forward, inshallah. Nina, let me know if we are good and how long it would be.
Yeah, I'll just give everyone another like 10 seconds.
Okay, perfect. So, and then we'll be able to see a little bit.
Mhm.
Okay, perfect. So the question for the poll was, I believe therapy is for serious mental health problem. 60% of you said serious mental health problem. When I struggle in life, that's 80%. My last resort, 20%. That's good to see. A healthy outlet, that's amazing. Part of self-care. I love that answer. I'm actually really glad that nobody said that they'd never go to therapy. Alhamdulillah. Okay, so let's move on to introduction. What is talk therapy? Is it something specific? Generally, what it is a form of treatment for mental, emotional, mood, or behavioral disorders. And it's a therapy that uses methods of verbal communication to develop self-awareness, emotional regulation, and coping skills. It's also now more recently referred to as psychotherapy. And this form of treatment is essentially very commonly used. So talk therapy is generally what people are referring to when they use the term therapy in itself. And it can be a very effective way to address and improve your connection in relationships, symptoms that come from disorders such as anxiety, depression. It can improve or help you manage those symptoms. And one of like a really great benefit is that you get to explore your feelings more deeply and develop helpful coping skills. A lot of us come from cultures where we don't really have a good relationship with our emotions. And so this form of therapy is very helpful to understand what I'm feeling and what emotion is telling me. Basically, what it is that it involves you meeting a therapist in a confidential setting to speak about anything that's causing you some level of emotional distress, right? These can include things like relationship, your behaviors, your unmet needs, your thoughts, emotions, illness, any big change in life, anything that's going on that's impacting your life and causing you emotional distress. So you work together with your therapist to like kind of discover like what are the main issues that are coming up. And once you do discover those, you work with your therapist to understand like how these stressors are impacting your daily life, and what is kind of holding you back. And then you work together to figure out like what strategies work for me and what are some solutions to manage or decrease some of these impacts and stressors, so that I can live like a healthier lifestyle, healthier, normal daily life. There's a few different types of talk therapy that I wanted to quickly mention for us. There's a lot of different types out there. I'm only mentioning about 6 that are very popular that you might see on people's profiles on Psychology Today or in papers, research papers and such. And one of the most commonly used one is called CBT, Cognitive Behavioral Therapy. And this is basically one that cognitive is like how you think, and then behavior is like how you're acting it out. And the point of this therapy is to see what's going on in your mind and what you're thinking and how that's impacting your behavior and interrupt that cycle at some point. So it's very effective for things like anxiety, for depression, for negative thought cycles, for overactive thought cycles, and breaking that chain between the thought and the behavior and the physiological response. So it helps you identify like the harmful thinking patterns of, harmful thinking patterns and behaviors that are kind of distorting your view of life. A good example is like, you come into a social setting with a social anxiety, and, because of your past experience or whatever may be coming in, and now you are required to be in a place where you have to be in a social setting, and it's really triggering for you. You have a physiological response. Your heartbeat goes like 1,000 miles per hour. You're sweating, you can't talk, you can't see properly. With CBT, the goal is to understand what thoughts are coming to your mind in that moment, and how are those thoughts impacting your body right now, and then breaking that cycle. So challenging those thoughts. Are those rooted in evidence, or are they coming from past experience? Is it still true? Is it not true, etc.? Another one that's really popularly used for trauma-based approach is EMDR, which is eye movement desensitization and reprocessing therapy. It's pairs processing traumatic memories with a type of bilateral stimulation, brain stimulation, and usually in the form of eye movement, because our experiences have an impact on our brain, right? Like the way that our brain functions, which areas are more highlighted. So this therapy works a little bit more towards desensitization. Then we have DBT, which is, using mindfulness practices and emotional regulation and distress tolerance approaches. So like finding your threshold, like how much can you tolerate? What are your thresholds essentially, to help you learn how to better cope with emotions. And really quickly, we have 3 more, which is psychodynamic, humanistic, and MBCT, mindfulness cognitive therapy. And a lot of these are approaches that you can borrow in, like any therapist may borrow from, humanistic and CBT and MBCT. Like these are all kind of, they work together. So you don't have, like most people will be specialized in a specific one, but that doesn't mean that you only practice that one, okay? Psychodynamic really quickly works a lot with unconscious meanings, unconscious thoughts, bringing them to the conscious and dealing with those. Humanistic believes in, the innate goodness of a person, and how do I actualize that level of goodness? And mindfulness-based cognitive therapy is, like it says, like it's about mindfulness, building a groundedness in life, bringing more awareness and connection with the world around you, without like, a right or wrong, but just accepting. So a lot of acceptance. So quickly going over like some of the benefits of going into therapy. It's one of the things, like you get to sit with a professional to develop effective coping skills that work for you. It's actually shown to improve psychological well-being. It can actually rewire your brain. So with brain imaging methods, it's shown that it can alter activity in the medial prefrontal cortex. So our frontal cortex is the one that's used for processing. And so prefrontal cortex, the anterior, I'm going to skip the big ones, but the hippocampus and the amygdala. And these are all areas that are in self-referential thoughts. So about me-centered approaches, ego-centered areas, our worry, thought, or anxiety, our executive control, emotion, and specifically fear. Amygdala is related to fear. So working with a professional in therapy can actually rewire your brain, because you're learning new coping skills that take the thoughts and how they impact it and disrupt that behavior. So you may be able to manage it better. So emotional regulation, self-awareness, it's one of the things that can actually help you improve connection with other people. So other people in your relationships, close relationships, friendships, developing connections with other people if you feel super disconnected and isolated. It's one of the things when you are better at understanding yourself, it helps you understand the world better around you. And it definitely has improved physical health benefits as well. When you're not always in a fight or flight response mode, your body is not always feeling that stress, then it can start to kind of unveil and really experience the world. So stress, as we know, can cause things like headaches or chronic pain or cramps and such of those things. And going to therapy, understanding those things, managing it better can help develop better physical health, inshallah. Some of the limitations, which I say this with caution because these are limitations that may be things that are uncomfortable as you're starting, but not necessarily things that can be like significant barriers that you cannot overcome. So some of those things are, it's actually, and I'm sure any of you who have gone to therapy before, it's one of those things that's very uncomfortable and it can leave you feeling very vulnerable, right? Because you're sitting with someone, you hopefully have a good connection with them, but sometimes you're in a place where it's a stranger and you're talking about things that you've guarded very close for most of your life. So it takes a lot of courage. It takes a lot of getting yourself into it and, being self-motivated to get there. And with that said, like, it may also take you several tries to find the therapist who is right for you. So just because, you've made the decision that I do want to find a therapist, I want to work on myself, unfortunately, it doesn't mean that you'd be able to click and connect with the first person you come across. Every therapist brings their own personality, their own training, their own life experience, and their individuality in the way that they're going to provide their therapy. And that may or may not work for you. So you may have to shop around a little bit to see, who are you comfortable with, in whose space are you comfortable sharing your vulnerable thoughts and feelings with. The other thing that sometimes people get deterred by is it honestly takes some time to see your progress and your results. Because if you're working on something that you've been experiencing for a significant time in your life, you're not going to be able to just overcome it in one go. There may be trial and error, you may try different strategies. It may or may not work. It requires active commitment. Like, you have to do the homework, you have to do the exercises, and if they're not working for you, you have to be very honest, be like, I didn't get time, I don't think this is going to work for me, or it's very uncomfortable, I don't know how to do this. So having that level of honesty and being committed to, like, I do want to change, I do want to do the homework, but here are the realistic things that ensure that I can't. So how do we work together with this? Some like logistical stuff is also sometimes, especially for psychotherapy right now, it may not be covered by insurance, especially if you do have coverage with your workplace, right? So with your employers. It can be expensive. There may be cost barriers or financial barriers to it. But at the same time, we do have options that allow us to overcome some of those barriers, right? Another thing is accessibility. A lot of places or people or psychotherapists have a really long wait list because it takes time, it takes effort. Once you are in, the therapist is committed to you, and there's a lot of people who want to do therapy these days. So a lot of places or organizations do have wait lists. But again, we will discuss some ways of how we can get around it at the end, inshallah. Are there any questions or comments so far that I should address?
We'll leave the questions to the end.
Okay. Okay, so I'll move on to some of the common misconceptions. So one of the questions that we regularly get asked is, what's the difference between a therapist or a counselor or a guidance counselor or a psychologist? So I listed the top four professions that deal with public-facing therapy, okay? So we have a psychotherapist, psychologist, psychiatrist, and a counselor. Each of these have their own regulatory bodies, okay? So all of them have different ones. The one that you'll see an overlap with is the counselor and the psychotherapist. So a psychotherapist is someone who cannot prescribe you medicine. They cannot diagnose you with a mental disorder or mental health disorder. They will be able to recognize and point you towards getting an actual assessment. However, they cannot give you a diagnosis. And generally, psychotherapists are trained in using different forms of talk therapy. There may be people who are also trained in different other forms of therapy, but generally it's talk-based therapy. A psychologist is someone who can assess and diagnose and treat mental health disorders, okay? Their main thing that they work in is researching human behavior, publishing studies, and they're the ones who will give you the assessment and the tests for spectrum disorder. So diagnosing things like ADHD, any level of attention deficit, autism, any level of those disorders. A psychiatrist is essentially a medical doctor. So they often work in, clinics or private practice, or they'll be in hospitals. They can diagnose, prescribe medication for mental health disorders, and they can also do treatments. However, they don't necessarily do talk therapy. So you might find that if you're going to a psychiatrist, your sessions may be much shorter than what you would get with like a psychotherapist or a counselor. Maybe even a psychologist. Psychologists, because they do assessments, it differs, it's different. But at the same time, like the psychiatrist is qualified to assess neurological and physical symptoms of your psychological issues. So again, like when we were talking about the relationship between the body and anxiety or stress, it would be the psychiatrist who would conduct those testing and that imaging to figure out how stress is impacting your body specifically, right? Now, just based on a study about how your brain is responding to the way that you're feeling and whatever mental health disorder you may be suffering from, they would be able to assess the neurological impact of that. Now, lastly, a counselor is someone who is required to also be registered with the CRPO. They do have their own licensing body, but they're also required to be psychotherapists for the most part, okay? They cannot diagnose, they cannot prescribe any medication. And the difference between therapy and counseling is essentially counseling is solution focused for a short term, for a specific purpose, okay? Whereas therapy can be a little bit longer term. There's more commitment, more work, and it can be more things like that are over the lifespan. So like your childhood, developing the inner child work, or dealing with specific issues like anxiety, depression. Whereas counseling, it's more about like grief counseling. There's a big impact, or something's significantly changed in your life and you need some support to get back on your feet. So it's a shorter period, very solution focused and brief therapy. So I'll move on from the common misconceptions, going on to common misconceptions specifically about therapy. And I use talk therapy and therapy interchangeably in the next two slides. But some of the answers or that were in the first poll question were related to these misconceptions. So I was really happy with what I saw, alhamdulillah. We have a very open crowd, alhamdulillah, and open about therapy. Some of these are things like, therapy is for people with severe mental health problems, or it's the last resort, or, that it's a sign of weakness, or it's mostly just talk. We know that these things are not true. So therapy is something that helps us. It can be maintenance therapy. It helps us function in a healthier way in our daily life, right? Whether that means with task management, whether that means with emotional regulation. Sometimes you do need a professional to sit down with to take account of what's going on in your life and see where are areas of improvement and where you may need to put it on the back burner, etc. And one thing I actually really wanted to highlight is often, some on different platforms we'll hear things like, my so and so is a therapist, and I just speak to them, or my friend are my biggest source of therapy. I just kind of vent to them, and they help guide, which is amazing, alhamdulillah, right? You have to have a support system who's able to support your mental health is a real true blessing, alhamdulillah. And at the same time, therapy is something that's a little bit more structured, and it needs to go a little bit more in depth. And it's not something that can be done by family and friends, because think about it, like you may not be able to have those really uncomfortable and difficult conversations with people that you love, right? If there's a lot of sometimes shame and stigma attached within our circles, I don't want to expose myself. I don't want the people who know me to know this about myself. And that can be a real barrier in you actually overcoming the thing that you're struggling with. So if you're not able to be honest with the person who is essentially providing you therapy, it's going to be very hard for it to work. It may not work the same way that it should. So that's why it's extremely important that when you are looking for a therapist, you look for someone who you can connect with and be very open and honest with. And that's also something that you can cultivate together, but someone essentially that you trust. Something I also wanted to highlight here is one perception that came up was that therapy is for those who can afford it. This like we were saying, that there may be financial barriers that you may come across, especially when you're looking for psychotherapy. However, alhamdulillah, with social services and investment in mental health projects right now, there are options where there's a lot of organizations can offer something called a scaling program for financial assistance. So what that means is that they will ask you for some documentation that asks like what your yearly income is, and based off of that, they may give you a rate that is more suitable for you. So someone who, like, let's say is below the poverty line, but wants to do therapy with an organization that offers a sliding scale, their session may even end up being free based on what their income is. It could be $20, $60, $100. It can go up to like whatever based on your income rate, right? And then the standard pricing of whatever the organization's is. Okay, so, and there are ways to go about it. You may also work with your insurance provider to see who they work with. So they have a list of professionals that they work with, and you can find which psychotherapist they work with and find the one that works best for you. Another thing is thinking about a therapist, though that your therapist is a trained professional, they've done the theory, they may have a lot of experience, but it's important to remember that they have never been in this therapeutic relationship with you. They may have a lot of experience dealing with people who have similar problems as you're presenting, right? They may have similar concerns, and they may have a lot of experience. Let's say, again, let's go back to anxiety. They may have a lot of experience with people who suffer from anxiety, but they do not have the experience of being in a relationship with you experiencing anxiety. And that's something that's very important to remember, which means there's no cookie cutter approach that kind of fits all. It's all about working together to figure out, okay, this level of this coping strategy works for me, but this is where I struggle, and I need something a little more customized to my life, to my personality, and to my needs. And that takes a lot of, again, work, talking, honesty, and honestly, sometimes it means that you're not going to feel better at the end of every session. Sometimes you may even walk away with very intense feelings of sadness, of anger, of whatever it is that you may be feeling. So think of it like this. Let's say that you have a jar and you've been storing away like food for a really long time, and then you really tightly closed it and you put it away for years and years and years, okay? And so when you're coming to therapy, essentially, you're opening up that jar. When you open it up, it's not going to be smelling very nice. It's not going to be very appealing. You may not even want to open. It's like, I just want to throw it out, right? But the caveat is you can't throw it out. It's always going to be there, and you're going to need to clean it out. If that is the analogy for your heart, or for, whatever, like your thoughts, what it requires is you will have to open it. When you do open it, it's going to bring up very difficult emotions, very difficult thoughts, experiences, right? And it's going to be very difficult to clean it out. You're going to need to use different tools to clean it out, right? To get it back to that shining and clear jar that it was before. And then you'd be like, and those tools are going to be your coping strategies. Those tools are going to be things that work for you. And once you do clean it out, you can start filling it with things that are healthier and better for you, right? And using it regularly. So you can't just put it away again. You have to learn to use it regularly. I hope that makes sense for everyone. So we'll move on to the last part of the presentation, which is like tips to finding your therapist. And then I've divided it here in about 5 steps. Basically, the first step is you have to understand yourself and what your needs are. Why am I seeking therapy? What do I need help with? Okay. And why am I seeking counsel right now? So that's the most important part of starting this process. And then you look at your preferences. So things like, perhaps like for myself, I would want to work with another female who's Muslim and understands my experience. And, hopefully within the same age range as around me. And who's someone who's perhaps like available online, because, maybe I don't want to do in person, or someone who's available in person because I'm done with online, right? And then if there's a specific type of modality that I want to use, like I don't want to do any type of somatic work, or I don't want to do any trauma work. I just want to be able to do some maintenance work, right? That gives me some of the boundaries of searching. Then I go into research. So the places that you want to look at are, again, friends and family. Are there anybody in your circles who have a good referral, who may have worked with someone, or who is someone that you would want to work with? There are online directories that you can check, things like Psychology Today. For us, for Muslims, there's an app called Ruh, R-U-H, care app, where Muslim psychotherapists sign up, and you can find someone who works for you. Another place to look at with your employer is your insurance provider. Again, like I said, they have a list of professionals that they work with, and it may be really helpful to look at that list so you don't have to worry about, like, are they going to accept my insurance, or going the extra step of filling out forms and all of that. They may have already internal agreements. So that would be a place to check out. And one that we often overlook is your family doctor. Your family doctor may have really significant resources that may help you find the right therapist. And so once you kind of have like a working list, you can call or message or email or contact them and schedule a free consultation. Most psychotherapists will offer a free consultation, which is a 15 to 30-minute conversation that kind of helps them understand what you're looking for, and for you to kind of get a sense of who they are and what they sound like, what their approach is, etc., and set the expectations for what therapy may look like. And that's where you really have a choice, right? Do I want to work with this person? I know, like, on paper, this person looked really good, but when I talked to them, I didn't really click, right? And that's okay. So I would encourage you to actually choose a therapist based on their approach, their experience, cost, and things that are important to you, right? The most important thing is that you should feel comfortable with them. You should feel like you can be completely and totally honest if pushed or if necessary, right? If this is someone that you feel like, no, I don't feel comfortable, you may have given it a chance, but I would encourage you to find people that you can be vulnerable with, okay? And then once you do start therapy, you'll be discussing like your common goals and your concerns, what your needs are. Like, these are things that I don't want to discuss. These are my boundaries. This is what I'm here for. And I really want to see these things in myself. And this is what I want to work with, right? There should never be a position where you feel that being led by someone else to do things that you did not want to do. right? And you always have the option to say, look, I need some time, I need some space, I'm going to reel this back a little bit. But once you do have a trusting relationship with your therapist, like, you should discuss how you're feeling and where you're leading with the therapist to see, what works or doesn't work. Because if you just kind of reel back without giving them any feedback, they're not going to be able to read your mind, and they may not be able to work with you, right? So that's why it's really important that you're able to trust your therapist and have openness with them. And then the rest of the sessions, like how long your therapy is going to be and what your goals are, all of those things you will work with your therapist to figure out. Generally, on average, therapy can be 9 to 12 sessions if you're doing something long term. So solution-focused counseling or brief therapy can be anywhere from 3 to 5 sessions, right? But again, it depends on who you're working with. So overall, talk therapy is it's a form of treatment that uses verbal communication to help develop self-awareness, emotional regulation, to manage symptoms of mental health disorders, and like it's a way to learn effective coping skills that work for you, right? A customized plan of coping skills that works for you. And it can be a really strong precursor to improved connection, especially in relationships, because a lot of people from Muslim communities come from a collective culture, and relationships are very important for us, and we often have challenges maintaining or improving relationships. And so this is a really important thing to keep in mind, especially for our communities, is that it can really help you improve the connection in your relationships, inshallah. You may have felt like I have breezed through certain things, but don't worry, inshallah, you'll be able to find our tip sheet at on our website at nisahelpline.com/wellness. So you just go in under talk therapy and you can get the tip sheet, inshallah. So with that, I'm going to hand it over back to Nina to move into our next sessions. Nina.
Thank you so much, Beena. That was actually amazing. I feel like I really, really learned a lot. And it seems like we do have a couple of questions. So what I'm going to do is, open up the floor for questions and comments. This is the time, guys, if you have questions for Beena, to put it in the Q&A section. And, Beena, this will give Beena a chance to try to help in whatever way. So one of the questions was, I know you were talking about how particular professions that would be best fit for neurodiverse people. But one of the questions was, is there any type of talk therapy that is particularly suited to neurodiverse people, specifically ADHD?
Mm-hmm. So again, one of the ones that's very commonly used is CBT, especially like for things like ADHD. Because there's so much stimulation that's coming in, and there's really a need to understand the stimulation and kind of slow down. So MBCT, which is mindfulness based cognitive therapy, which helps you learn skills that are grounding in the present moment and now. So it helps you manage the stimulation that's coming at you in like a mindfulness based perspective. So two that I think are really beneficial and definitely used for ADHD are MBCT and CBT. So cognitive behavior therapy and mindfulness based cognitive therapy.
That's awesome. Thank you so much. Another question is, what modality is best in dealing with self-loathing?
Sorry?
What modality is best for dealing with self-loathing?
What modality is self-loathing? So self-awareness and anything to do with self-esteem, I highly, again, go back to CBT, right? Self-loathing is to understand it and where it comes from, and the thought process, or what thoughts are coming in, right? Because it's very much what's going on in your mind. To unpack what's going on in your mind, I would say use CBT as a modality. And then to counter it, I would say once you move forward, using Humanistic. And again, that's only my approach. You would have to work with your own therapist to actually figure out what works best for you. This is just like a general answer I'm giving based on, like, you know, specifically for self-loathing. It may not work for you. So would highly recommend you work with your therapist. But something I would suggest is CBT and then Humanistic, because that's very accepting and non-judgmental, and like promotes self-love.
Yeah. So part of that was you were saying CBT is good for interrupting potentially negative thought
Mhm.
cycles, essentially, right? Which is why you
Exactly.
recommend that for something like self-loathing. Okay, that makes a
Mhm.
lot of sense.
Yeah.
I know you were talking about the difference between having a friend support group versus having like a counselor or a therapist. Um,
Mhm.
and part of the reason is, you might not want to mention everything to your friends due to judgment. Yes, I can speak louder. Sorry, can you hear me now? Okay. Um, so in therapy, do I have to discuss everything? Like, can I leave things out? Do I have to just open up a can of worms? Like, how would you recommend navigating?
Yeah. So I like it's, you know what, no matter when you go to therapy, it's not going to be something that you'll be able to talk about everything, right? You may not be able to talk about your childhood. You may not be able to talk about, you know, your work stress. Or so when you are going to therapy, this is like going back to our, you know, finding the tips, basically finding what my need is in the moment. What am I trying to work at, right? um I may have things that come up from my childhood, but that may not be something that's important to deal with right now. Right now it may be that I'm in a situation where I really need to learn how to manage my anger and my emotions, okay? And so that's going to be the primary thing that I'm working on, right? You don't have to go everywhere. That could be your boundary. Like, I want to work at managing and learning coping skills right now. I don't want to talk about my childhood. I don't want to talk about trauma. I don't want to talk about future planning. I want to talk about this specific thing. And that's where knowing my needs and knowing my boundaries comes in and is very important, right? You don't have to open up and clean everything out in one go. That's virtually impossible. So manage your expectations. It's going to be a longer process, but it's going to be something that, inshallah, is very helpful throughout your daily life.
Okay, thanks so much. There's one last question.
Mhm.
Is there a difference between having a therapist that's from your faith versus not? And how might that, contribute to your experience potentially?
Mhm. There definitely is. And again, this is my personal answer. It depends on, you know, what you're looking for. For some people, it's not a huge issue because, you know, for them, they're not looking for a faith-based approach. But it definitely helps to have someone understand your cultural perspective and your faith-based perspective, and how that impacts the way that you live your life, right? Especially if it's someone who's practicing. So not necessarily even, you know, not just for Muslims, but it could be any religion, right? If someone is practicing and their faith is an integral part of their life, even if it's something like, you, hey, I'm not too practicing, but you know, my faith is extremely important to me, and I'd like to get there. If it's something that's important to you, I would highly recommend that you find someone who understands, one, your faith, may relate, and can give you a faith-based approach. Because when you go to someone who does not understand those nuances, you may not find that their strategies work for you. They may be very foreign. They may be very uncomfortable, very unrealistic for you. We've had so many, like I've come across so many people who share that, you know, as a Muslim person, they go to someone who doesn't use a faith-based approach, or they don't understand, and they'll encourage or give advice or do give them modalities or things to do that are kind of outside of bounds, like things like, you know, they're working on setting boundaries with their relationships, right? Especially like if you live in a joint family system, you have like 3 other siblings and your parent, and you're working on boundaries, and your therapist goes, well, you need to be very vocal and use verbal communication. And coming from a culture, a collective culture, that in a faith that highly values your relationships and your kinships, that may not go over so well, and your therapist is not able to understand that, and that kind of creates like a clash, and then it goes into a negative cycle of like, oh man, like, I tried so hard, this just isn't for me, this is not going to work, etc., etc., right? So it's really helpful to actually find someone that you can connect with on many levels, as many levels as possible. So your culture, your faith, your experiences, whatever the case may be. And if faith is something that's important to you, I would highly recommend that you do find another therapist who also values faith in the same capacity.
Okay, that makes a lot of sense actually. I see in the comments, Solange had also said that sometimes you can end up the time that you should be spending kind of discussing the problem at hand or the support that you need, you end up spending that time providing context, like explaining
Exactly.
the Islamic perspective when that time could be utilized in a far more productive way.
Exactly. You're paying for that time, right? If
Yeah,
someone wants to get educated, they need to do it at their own time.
yeah,
Yeah.
that's fair. That makes a lot of sense.
Mhm.
Okay, that is our last question. Thank you so much for answering those. You answered them very in depth, and I really appreciate that. I know I learned a lot.
Alhamdulillah, Jazakallah khair for having me. I will leave the rest of it over for you, inshallah.
Sure. So, this is kind of our chance to also introduce you guys to a new service that Nisa Helpline is actually providing. It is a pilot project that's occurring until the end of the year, but essentially it's a mental health counseling service. It's a partnership that we've had with Let's Talk, and the idea is that we have some mental health counselors that are registered and professionals within their field, and they are offering free sessions. So this would be considered short-term counseling, which Beena kind of discussed and went into during the presentation. So it'd be free sessions at no cost to you as users. It is independent of the helpline. So essentially, it wouldn't be the peer counselors helping you, it would be these mental health counselors helping you. And so we're launching this service, and we're hoping it can be of use to people, considering Dina has discussed, the challenges in finding kind of a faith-based approach to, uh, you know, any type of therapy or counseling, as well as barriers that can be such as cost, uh, limitations in accessibility because it would all be done over the phone. Um, so yeah, you can book an appointment online, which would be the booking an appointment online will actually launch in a couple of days, in about a week, but you can actually already go ahead and book a session through the helpline. So if you call the helpline and you let them know, I heard about this mental health counseling service that's being offered through Nisa Helpline. Can you book me in? A peer counselor will be able to, hop in and book a session for you. And then, inshallah, after a week, once you've launched it on the website, you'll be able to actually go in and book in a time slot for yourself if you don't want to go through the helpline. I do see a couple questions coming in. When is the service going to start? It's actually already started. So we've been taking clients. We just hadn't kind of advertised it too much, but it's live. You can go ahead and call the helpline. And like I said, in a couple of days, you'll be able to book appointments online. And yes, it is women only. The MHCs, the mental health counselors, are also women, Muslim women, like I said, professionals in the field. So inshallah, it will be of some use to people. Um, can you go to the next slide? Yeah. So this is one of our mental health counselors. She's actually the one that made the toolkit, or sorry, the self-help guide that's associated with this talk therapy session. Her name is Amina Jamaat, and she's really nice. She's already been working on the service so far, and if you're interested, she's not the only mental health counselor, but she is the one who made our talk therapy self-help guide. If you could go to the next slide. So feel free to call the helpline if you have any questions, of course, and to book in a session because I think it would be really beneficial for people. So that is what our resource will look like. You guys should get it in your email if you've registered. If you haven't registered, then you can go to nisahelpline.com/wellness and you can register there, and then it should be emailed to you, inshallah. You can also, I believe the registrations for our next workshops are already up on nisahelpline.com/wellness, and that will be on family dynamics, navigating family dynamics specifically by and Rena Vanta will be joining us. So I know Beena was talking about our collective culture and how we navigate those things, and part of that is our families. So those are some of the things we'll be discussing at this workshop. So I hope you guys join us. Thank you all once again for joining us this evening. If there are no further questions, I think we can wrap it up here. Thank you so much, Beena. This was amazing.
Thank you so much, guys. Take care. Assalamu alaikum wa rahmatullah.
Wa alaikum assalam wa rahmatullahi wa barakatuh.